Hi everyone, Connie here. As a women's health specialist, I see a diverse range of issues from simple urinary incontinence to severe endometriosis or PCOS. And within the last week, I've seen 3 patients, 2 of which couldn't conceive because of endometriosis, and 1 that is experiencing so much fatigue that she can't finish school. And the interesting thing is that these women also had a host of other issues. Issues like Hashimoto's, hypothyroid, hormonal imbalances, digestive problems, and fatigue. And for those of you who don't know, Hashimoto disease is an autoimmune condition which attacks your thyroid. So going back to what sparked my curiosity time and time again in my 19 years of clinical experience, I find that the conventional medical system really misses the mark when a patient has a slew of symptoms that overlap multiple diseases. So today, I want to go more in depth about endometriosis, what it is, its symptoms, causes, and treatment. Then I want to provide you with my 2 cents about this condition. So what is endometriosis? Well, endometriosis is a painful, chronic disease that affects over 6.3 million women and young girls all over the world. It's when the tissue that lines the uterus, the endometrium, grows outside the uterus, typically in the abdomen, on the ovaries, fallopian tubes, and ligaments that support the uterus, the area between the vagina and the rectum, and other outer surfaces of the uterus and the lining of the pelvic cavity. Other less common sites for these endometrial growths may include the bladder, the bowel, vagina, cervix, the vulva, and in abdominal surgical scars. And this abnormal growth develops lesions which respond to the menstrual cycle in the same way that the tissue of the uterine lining does. Each month, the tissue builds up, breaks down, and then sheds. So typically, menstrual blood flows from the uterus out to the vagina. However, the blood and the tissue from the endometrial growths have no way of leaving the body. This ultimately leads to the systemic inflammation causing pain, infertility, scar tissue formation, adhesions, and bowel problems. So what are some of the symptoms of endometriosis? Pain before and during periods, severe pain, pain with sex, infertility, fatigue, painful urination during periods, and painful bowel movements during the periods, gut issues like bloating, cramping, constipation, and diarrhea, and many other slew of symptoms such as allergies, chemical sensitivities, frequent yeast infections, autoimmune symptoms, migraines, and celiac disease. The problem. A discouraging fact is that diagnosis is considered uncertain until proven by laparoscopy, which is a minor surgical procedure done under anesthesia. A laparoscopy can identify the location, the size, and extent of the growths. This helps the doctor and the patient make better treatment choices. But according to the 2016 article written by Obstetrics and Gynecology, it was found that fewer than 25% of women undergoing laparoscopic or abdominal hysterectomy for chronic pelvic pain have endometriosis at the time of surgery. Essentially, 3,768 women with chronic pelvic pain were offered a hysterectomy to treat their pelvic pain because it was believed they might have endometriosis. And out of those 3,768 women, about 2,826 of them got a hysterectomy and did not end up having endometriosis. Another problem I see is that because the underlying inflammation is never addressed appropriately, patients with endometriosis develop more adhesions after such laparoscopic surgeries. This is where I meet my patients. It's really sad when I see a teenager who can't eat but gains weight, is in severe pain and severely depressed and so fatigued and is talking about removing her ovaries, all before she's 21. So let's talk about what causes endometriosis. Just like lupus and various other autoimmune conditions, the cause of endometriosis is unknown. But there is the retrograde menstruation theory or transtubal migration theory, which suggests that during menstruation, some of the menstrual tissues back up through the fallopian tubes, implants in the abdomen, and grows. Some experts believe that all women experience some menstrual tissue backup and that an immune system problem or hormonal problem allows this tissue to grow into or in the women who develop endometriosis. There are other theories about the migrations of urine tissue via lymph tissue, and there's theories about genetic predisposition. But this still doesn't answer the question. In fact, limited research is done on measuring inflammatory biomarkers and/or assessing patients' lifestyle habits to begin to deduce some logical answers to this problem. And the patients that I see are ones that have had multiple surgeries, are on a host of meds to control the pain, have depression and constipation, and various digestive issues. They have very little hope even after multiple surgeries. My experience in research indicates that our systems, such as the endocrine, responsible for hormone synthesis, digestive, neuromusculoskeletal, cardiometabolic, and immune systems, become disruptive with toxic overload. And because we live in a toxic world, the chronic burden of eating junk foods, those infested with chemicals, pesticides, antibiotics, hormones, etc., and breathing in toxic air from the pollutants from exhaust and various others, and stress from our occupation, we are connected on various devices taking up our mental space. This all collectively perpetuate the inflammation and the disease process. So endometriosis is only one of many conditions that are on the rise today. I want to let you know that all disease process is reversible with a common sense approach to health and wellness, but it does require your effort. As someone who lived with a chronic medical condition, I can tell you that you can build resistance and create health from disease. And endometriosis does not have to take over your life. It saddens me to see many older patients who had to give up their ovaries to the condition and as a result had given up their chance at creating life. That to me is a huge consequence. I too was told against having kids due to the risks. I took my chance though and did it not once but twice successfully. This is where I really get fired up about taking an active stance on your health. For me, at the end of the day, I've had to take an active role in keeping my inflammation down by continuing to put forth the effort to do the following. Number one is eating nourishing foods to build your gut health and decrease systemic inflammation because food is ultimately medicine. And two is to build resilience to stress by actively checking into your body and tuning in. This is simple, just breathe and close your eyes. They call this meditation. Allow your heart rate to stabilize and use imagery to help shift your autoimmune system or autonomic system to a state of calmness. And three is to move your body to enhance detox, build strength and stability to create a healthy environment for your cells to thrive. It's also anti-inflammatory. Those of you who follow my blogs know that I feel very strongly that inflammation is the root cause to all disease. So to me, it's quite simple. Every disease process starts with inflammation. The answer lies in helping your body establish an anti-inflammatory environment. I've done so in my life, and I'm living proof that your efforts do pay off. I encourage you to take an active role in creating your health so that you can age successfully. Again, thanks so much again for joining me today for my blog. And as always, please like, share, and subscribe to my social media channels. And I will see you next time.